Okay, thank you. Welcome to Government Operations Committee. We will go ahead and get started. We're still waiting for one committee member show up. All right. Changes to the agenda. I believe you all should have been given a packet of lots of information. We need to add resolution ID 10297, which is budget adjustment and appropriation of unspent funds from 2020 and prior years to various accounts of the departments that report to the Government Operations Committee. So can I have someone move to add that to our agenda? Leslie, second. Dan, all in favor of adding that to the agenda? Rich and Leslie? Yes, okay. Thank you. I guess I'll put that under the legislature stuff. Other changes to the agenda? Anything else? Okay. You have to keep me on track, Kathy and Brittany. Comments from the public? All right, no comments from the public. Let's take the minutes from July 1st, 2021. Dan moves. Rich or Leslie? Rich seconds. Any questions or comments about the minutes from our last meeting? All right, all in favor of approving those? That's unanimous, thank you. All right, we have an appointment to the Ernest and Warren Supreme Court Library Board of Trustees, which that paper was just given to you today. And that will be Deborah Dawson, County Legislator. Term expires 10/2/2023. Would anyone like an executive session to talk about Deborah?
Maybe a therapy session.
Maybe a therapy session.
Be careful, I'm here.
Okay, questions or comments about that? No. We need a motion. Yes, Rich, Leslie seconds. Okay, all in favor? That's unanimous. Good luck, Deborah. Have fun with that. All right. Moving on to Department of Planning and Sustainability. Darby Kiley is here from Maine, I believe. Thank you for taking a break from your trip and coming to talk to us. And take it away, Darby.
Happy to be here. It's actually quite a rainy day in Maine, so it's fine. But I got my Dryden background here, so you don't think I'm somewhere fun right now. So every year we review the foreclosure list for potential properties per the land transaction policy. So that's section 0907 of the administrative policy. And so we're looking for natural, cultural, historic significance or any risks that could be on parcels if we were to foreclose on them and then sell at auction. So the Department of Planning and Sustainability reviews that list and works with our Rick and Jonathan and Jay to kind of go over that list and make sure things make sense. And as usual, things get paid off to the very end. And so this is always a list of recommendations, but we know some things could change. And because there was not an auction last year, we really end up not having many changes from last year's list. So the three parcels we're recommending for withholding on Fall Creek Road in the village of Freeville, and then the two in Newfield were actually approved for withholding last year, but want to just reiterate that approval and to keep them off the foreclosure list. And again, the one in Freeville runs right on Fall Creek, and is kind of a buffer between the bridge of Route 38 and some parcels that the village already owns, and then the tile place, if you're familiar with that, on Fall Creek Road. So it's mostly creek bed is the parcel, and then a small amount of land. So it'd be good to protect that just for any future encroachment. And the village is interested, and so we'll follow up with them if it is withheld and not paid off before the auction, to pursue getting their the land into their name. And so then the other two parcels came up. It's actually the third year we haven't really made much progress on coming to a resolution with the stormwater parcels in a residential subdivision in the town of Newfield. But the town has been making progress. So I'm hopeful that working with the neighbors in that residential subdivision, that they can figure out the best path forward. Right now, it's basically not in compliance with the maintenance agreement that the developer and the town signed. And so hopefully I'm not part of the but that can be handed over either to a homeowners association or to the town, so they can maintain the stormwater parcels and move that forward. So then let me just go over the other two here, or the other one is on Contingent Road in the town of Caroline. It's a relatively large parcel, just almost 15 acres. And the eastern 3 or 4 acres is right along, is in wetlands, and then it also borders the Finger Lakes Trail. So we are recommending having a deed restriction placed on kind of the eastern portion of that, but still be sold at auction, because it seems to me it'd be sufficient amount of land to still build a house on and have the appropriate septic systems and wells without having encroaching on any wetlands areas. So that would be our recommendation for that. And then just the kind of the report on, there's a parcel held last year, even though it did not go to auction, but it did allow time, had there been an auction, for the just an estate to be straightened out, and then the property was redeemed, and I think they're working on getting the land into state parks ownership. So that's in the town of Enfield on Stonehouse Road. So that is, and then it also includes the budget implications in terms of how much taxes are paid on these parcels. In the village of Freeville, it's about $180 a year, and those two Newfield stormwater parcels total about $99 a year in taxes. So it's pretty low amount for just the effort in trying to get these moved into the hands that will take appropriate care of them. So with that, I'll take any questions that you might have.
Great, thank you for going through that. Questions from anybody? Some of these are familiar, we've looked at them in the past. Rich?
Just to be clear, just to be clear, the list on page 17 of the packet, is that all the properties?
That is all the properties, yes. So
there's no properties in Ulysses, for example?
There's no problem. Sorry, I have to repeat that. It's a little hard to hear. Did you say there's no property in Ulysses? Is that what you said?
Well, on the sheet that I have in my packet, it's cut off, so I can't see the whole sheet. And it seemed like it was going in alphabetical order, but it stops in Newfield. So there's no other properties?
Correct. There are no other properties.
Thanks.
Okay. Anything else? All right, I think you're looking for approval from us, right, Darby?
Correct.
So can I have a motion to approve to withhold 3 parcels from the 2021 foreclosure auction and approval to sell 1 parcel subject to the deed restrictions? Dan will move that. Rich will second that. Any other questions? All right, all in favor? That's unanimous. Thank you so much, Darby.
Thanks, guys. Have a good day.
You too.
Bye.
Hope it stops raining. Okay. All right, we are up to information technology services, and Greg Potter is here. We have a couple of resolutions, so why don't we go ahead and move the first one, and then you can talk to us, Greg. That is Rich is going to move. Let's see, this is appropriation from contingent fund, upgrade of internet services, provider bandwidth and technology, ITS department. Rich moved, seconded by Leslie. Okay, hi.
Nice to see everyone in person. So during the pandemic, when everyone was working remotely, we did one round of upgrade of our internet bandwidth to allow the use of access to the county network from locations. That went well. We did an upgrade then that included that within our current last year's budget to do so. This year it's a little bit different since everyone is starting to return to their offices and doing the work on-prem, but still using the same video technology to do so. We've run into some limitations on bandwidth and some problems recently, particularly with mental health and the clients that they serve through video conferencing to provide for the appropriate bandwidth. So we have two ISPs, one with First Light and one with Spectrum, and they're load balanced on our network. One of those connections comes through the Uptown Data Center, which is at Emergency Response Department. The other one is downtown in their office. So they're designed to work with each other to load balance the traffic, and where if one fails, then everything switches over to the other. So the current bandwidth that we have is not capable of supporting the advanced uses now internally. So we need to upgrade both the ISPs for bandwidth as well as the load balancing equipment, which is called backpipe, to make the increase of traffic more reasonable for the users in their offices. So that's what this is about. It's supposed to.
I like simple terms when it comes to this kind of stuff because I don't get it. Questions for Greg about this one? Or comments? All right, I see none. Let's see, we moved and seconded it, so all in favor? That's unanimous. Great.
Before we move on, the second thing I need to mention with this particular topic is that this will be added to the 22 budget as an additional OTR because we weren't expecting to do this by the time the budget was seated. So we're going to include this.
Okay.
But actually, it's going to be a little bit more because this is only for a 6 month period, not the full 12. So this is the incremental difference. Let's say it for 6 months, we need to cover the incremental difference for 12 months and 20. So you see that.
Okay, that makes sense. Thank you. All right. Next resolution is appropriation from contingent fund, human resources and payroll mitigation project, ITS ID 10295. And can I have somebody move that?
The one in the packet or the amended, the revised? I would move the revised version.
Okay. Can you move the revised version? Okay. Second. Leslie seconds the revised version, and Greg.
Okay. So first off, the only difference with the revised version is the account number details that Rick Snyder had responded to and provided some changes to make it a little bit more, much more accurate than was first submitted by RTS. This one is a little bit more complicated, so bear with me in my written description of this. The county over the past decade has relied on a software system known as Infor that we hosted on site. A couple of years ago, or about 3 years ago, we started the project to review the replacement of it because it's gotten really complicated and really expensive for us to host and support internally. And the person who really understands HR payroll from ITS, who's been involved with it for the past 30 years, has since retired. So we were trying to align that project review with a team that involved ITS, HR, finance department, and county administration to move this forward. So the first step of that project was to create a capital account, which we did, had approved for that project for replacement in the amount of $200,000. That capital account has been extended and closed, and was based on us moving to a new software solution that merged all of the requirements for HR payroll processing into one system. Currently, there are about in the transit, so we went through and made a decision and selected the vendor after a number of software company interviews with the team. Picked Kronos, which is now known as okay. So they host this solution in their data center, so it's available to us remotely, and they take care of all the servers. It also combined all of the time card systems that we currently use or have used in the past. We've had over half the time placed on paper, so all the time for paper. So we've implemented the two modules from UKG already. One is for the sheriff's department for the advanced scheduling for the 24/7 operations and their bidding for shifts. So that's been implemented and it's gone really well. The second piece of that is the time and labor system, which is like time, and the employee self-service. So and electronic time clocks would be common. So to date, we have implemented both those systems, and every county employee now submits their time cards electronically. The piece of the puzzle, there's three modules that have yet to be implemented completely, and they include HR, which is the management of all the information about each individual and the job classification and the payment and benefits that are associated with them in that total, as well as the piece, which is the payroll module, which really does the calculations based on how much a person earns within a pay period working. So there's a lot of detail. In addition, there's another module, which is the Affordable Care Act that we have yet to roll out, but we think we will actually go live. So it's another piece of it. So what happened with the project is that since the UKG project is based on a SaaS model or subscription as a service model, we pay monthly based on the number of accounts for each one of those modules, we had to invest in their software at two levels. One is just the software licensing, and the other is professional services. So the first 2 years, let's say, or a year and a half, the project to move us from Infor to UKG was covered under the capital project, as well as the one-time professional services. We didn't meet the deadline for implementation of all the UKG modules in order to eliminate our payment to the existing vendor, Infor. So we could pay another year for Infor to keep that system up and running in our data center. That led to over unexpected costs for implementing the entire project from that side, as well as the need to continually or to pay one of my employees who understands this world very well, was retired over a year ago, but came back to work during the pandemic. That was unbudgeted in the county side, particularly in ITS. And so part of this request is for the payment to get us covered for to reimburse another capital account that we paid UKT out of during the course of the pandemic when things were kind of crazy. So use this account. But that took money away from us for the infrastructure. So we have to replenish that to replace and upgrade what we plan to do for this year for infrastructure, which leads to the backend in the source. So that's one piece. The second piece is to cover the salary increases for the person in my department who is kind of like taking the lead in project management. Things have settled a little bit. And we're really close. I'm going live with other two modules, and it's expected that we hope to go live for October, for those two. So we will continue to push forward and make it happen. But there's a lot of application in the data and the processes that are used in HR and finance to use them. Please keep in mind that whatever percentage of the county's budget that we have for salary changes goes through the software. So this is really in terms of what we do internally and how we operate. And Lisa, who is very involved in this project, interim HR commissioner can attest to that. So that's really it in a simple of a description that I can provide. But I'm more than happy to spend as much time as we need to go through the details of how we got to where we are. You know, a lot of it was just the timing of what we were dealing with in the pandemic, ITS, and the other parts as well. We missed the deadline for going live to eliminate the additional staff and to info. After this is all said and done, when we go live, then we do have plans to shift the some of the annual expenses from my department to those that are closest to the software and any additional support they need. I mean, ITS traditionally doesn't provide this level of support and detail to payroll. Sorry, we have to do so. The person that really understands this is retired, and it's impossible to find replacement for the county that are going to the source of the software companies that help facilitate changes. So, and there are changes all the time based on contract.
Phew, all right.
Yes.
Questions? Leslie?
So just so I understand, it looks like in the amended revised resolution, what we're changing is the ITS infrastructure 2024 to contribution to construction.
Yeah, so we had to pay for the contract, the annual contract for PKT from that capital account. It was a decision made because we had to pay a bill that was only so. But if we don't reimburse that money, then we can't update the infrastructure on the our network, which is great.
Okay, other questions?
Okay, well, we're glad you know what you're doing.
Okay. I think we moved in second, so all in favor? That's unanimous. Great. Thank you. Anything else you want to update us on while you're here?
No, I'll stick around for the redistricting conversation.
Okay.
I see that's coming up, so I'll be in there.
Okay. Cool. Thank you.
Thank you.
All right. All right, I believe we are moving on to assessment and Jay Franklin. We have several resolutions, so let's get to it. First one is adoption of regular and supplemental reports of footings, totals, and assessment roles. Can I have someone move that, please? Rich, seconded by Dan. And hi, Jay.
Hello, everyone. How are y'all?
All right, welcome. You want to say anything about this?
Yes, I just want to say we're doing this because we always did it this way. And I never get to say that in anything. So this is just one of those historic things in case anyone ever wants to go back and compile this. I want to keep the same format as we've had for 50 some years. So.
Right, and I remember you saying that last year, so.
Yeah, and that's the only time I get to say something like that, so.
You're consistent.
Yeah.
Any questions about this for Jay? All right, all in favor? That's unanimous, thank you. All right, let's see, where's the next one? Okay, this is establishing county equalization rates, doc ID 10281. Oh, Kathy?
I mean, that looks like Mike Lane has his hand.
Oh, I'm sorry, I can't tell. Mike, go ahead.
At some point, I wanted to ask Jay a question, but please, at the end of your actions here.
Okay, all right, let's do the resolutions first. Yeah, so like, are people putting their hands up on there, Kathy? And
Yes,
okay,
yes.
so I'll just look up there every now and then, or you can tell me.
Okay. It is hard to see.
I would move the resolution establishing county equalization.
Great, thank you, Rich. Seconded by Dan. And Jay, what do you want to say about this one?
Well, this is pretty basic. It just allows us to apportion taxes in 2022 for the county.
Great, questions, comments, Rich?
We had a discussion at the last GO meeting regarding being able to maintain 100% valuations. Does this have any impact on that?
No, this is what the 2021 assessment roll is. So this was all the work we did during 2020.
But this is what we want to continue to do, correct?
Correct. Yeah, we would want to keep seeing 100 in there rather than 80.
Right, other questions? Nope, all right, let's go ahead and vote, all in favor? That's unanimous, thank you. All right, resolution ID 10284, urging New York State to adopt a conservation easement exemption for Tompkins County. Can I have someone with that, please? Rich, seconded by Dan. And this is something we talked about last meeting as well. So go ahead, Jay, you want to remind us?
Yep. So the town of Danby got the state legislature to authorize legislation, which once signed by the governor, would be eligible for the town to adopt that through a local law. Also included in that is the provision that we as the county or a school district could offer a conservation easement, but only for parcels within the town of Danby, and also only for parcels who have a conservation easement agreement through the town. So it would exclude any Finger Lakes Land Trust or any sort of other qualifying organization. So I think we should urge New York State to allow us to offer this exemption across the whole county and not just one town in order to be equitable. And I also think that we should allow conservation easements that were granted to a qualifying organization to be eligible, as opposed to putting work on a town to accept the conservation easement. And I'm still have to work with the land trust and the state in order to define what a good qualifying organization is. I wouldn't want to see a conservation easement transferred to John Doe and then, to have it be in perpetuity. And then 3 years later, after getting the exemption, John Doe then transfers that easement back to that parcel and they can build on it. So we still got some language to work around on that. but nothing that I don't think we can accomplish because it's similar to what we did in the housing trust exemption and trying to work through that.
Okay, questions or comments about this? Dan?
I'm just very, very conflicted about this one for a variety of reasons. I guess the budget implications, there's no way to predict, how much this spreads out the cost to others. But the one that really gets to me is the temporary nature of the some of the exemptions and the conservation easements. So if you look, there's 50% if the conservation easement is as little as 15 years. I'm just not convinced that a 15-year conservation easement has any value at all. I just am not convinced, and I guess I would like to hear other people's thoughts about that. Let me just say it a little further. So what that means, I'm just as an example, just making this up. So I'm like, okay, well, I'm intending to stay in my house for another 15 years. I'm not planning on selling or developing. So I'm going to try to get a 15-year exemption to get half off my taxes. But it's my intention in 15 years, I'm going to, let that expire, and then I'm going to develop or sell without a conservation easement on it. So how did that help anybody except me? How did that help preserve any land, and how did that affect the other taxpayers' income?
Well, that is an interesting question. Rich?
First, I note the economist who said in the long run, we're all dead. We all live in the short run. And I share your concern that you could have a bad exemption where there really isn't any public benefit. I would anticipate, though, that the towns would be policing that as well, and they have common cause with us in trying to preserve their tax base. That this would not be offered. And it doesn't have to be offered at 50%, as I read it. The bills give the county the ability to offer an exemption, and I assume we could offer it at a lower amount. But, yeah.
Kathy?
Deborah has her hand up as well.
Thank you.
Yeah, thank
Go ahead, Deborah.
Yeah, you raise an interesting point, Dan, but I would think that if you convey the property without the easement ceases to exist, and the basis for the tax exemption also ceases to exist. Isn't that true?
No.
Well, that's a big loophole, isn't it?
I guess I would save in taxes for 15 years. And then I start paying full taxes again.
Well, Mike seems to suggest that that's not the case. That if you sell the property without the easement, the exemption is still attached to the property. Is that what you're saying, Mike?
Yes, the only way to have it go away is through total non-use or a release from the person who the easement was granted to.
Yeah, I think Dan's point, though, is that somebody could get the benefit of the exemption where they don't plan to do anything different with their house for the next 15 years anyway. Like my house in the city, I could say, I'm going to put it in a conservation easement because I'm not going to move in the next 15 years and cut my taxes, and then at the end, sell it. Is that what you're saying, Dan?
It's exactly what I'm saying, because all the other, as far as I know, all the other Finger Lakes land trust exemptions are in perpetuity. Danby has its own conservation advisory council that negotiates conservation easements to the town. They are in perpetuity. I am fully in support of that. I just question the value of a temporary conservation.
I appreciate you bringing that up. I see Jonathan came on the screen. Did you have anything to add?
Not a whole lot. I mean, conservation easements, they belong to the holder of the easement. And when Jay talks about having a qualifying entity, I think that's the key to it. Something like the Nature Conservancy or the Finger Lakes Land Trust, or an entity that is a not-for-profit that's devoted to maintaining land development or preventing land development or preserving unique lands and endangered species is what the Nature Conservancies is. Some qualifying organization, I mean, you shouldn't be able to give it to anybody who could then give it back to you. So it only makes sense in my mind if it is held by a qualifying organization, which I don't think would be too hard to define.
Or a perpetual easement.
Well, even so, I mean, a perpetual easement, if I could give you a perpetual easement and then you could give it away. I mean, because the easement is, say, to your benefit, and you can always give it away. The issue is the Finger Lakes Land Trust is not going to give it away. The Nature Conservancy is not going to give it away. So, I mean, something to ensure that it's held by an entity which would not be inclined to just give it away.
So then is what Dan is saying, is that possible that an individual property owner could get this benefit?
Well, what Dan is saying, I mean, if Dan has a conservation easement on his property, somebody else holds the conservation easement, not Dan. You don't have a conservation easement on property. Somebody else has that easement on Dan's property, which is basically that Dan can't develop his property. The problem is that if it's Dan's best buddy, then at the end of 15 years, Dan's best buddy could just sell it back to him for $1, and then he wouldn't have a conservation easement. That's the whole point of it being held by a qualified entity.
Yeah.
So help me understand. I thought I understood this differently, which is the town, for instance, in this case, the town of Danby, would have the power under this law to grant a 15-year exemption. Is that correct? Not worried about somebody else giving away in 15 years. They could grant a 15-year exemption and it automatically expires. No, Jay?
No, that's for the amount of the easement. So if it's a 15 to 29-year easement, it would be a 50% exemption only on the land that is included in that easement. So a house wouldn't be included. So it would be a 50% for the 15 years of the easement, or say if the easement was 20 years given to somebody, it would be a 50%. And I do agree that these are excessive percentages. There's at the perpetual easement, no other exemption offers something as large as this. Only the wholly exemption for not-for-profits, schools, things like that offer 100%. The next highest percent exemption is for the forestry, which they guarantee they're not going to do anything with, and that's only at 80% of what the forestry land is. So if this was me, and I typically don't give my opinion on exemptions, but I seem to be talking more and more. I don't see how a easement that isn't in perpetuity is really a benefit.
Thank you. Now, just to be clear, so the town under this law could grant a 15-year conservation easement. It's not it's not perpetual and it changes over time. They could grant as little as 15 years.
Correct.
Okay.
That's what they urge New York State to do. We could urge New York State to only do perpetual at 90%, at 80%.
Right. Rich?
Yeah, I'm curious, why did Danby do this?
I don't know. I haven't talked to Danby yet. I was unaware that they were doing this. I knew they were considering it, but I didn't know that they actually had talked to Assemblywoman Kellis's office to bring this forward.
And I guess I could just say there's new administration as of a year and a half ago, and land conservation is a big priority of theirs, and they formed these subcommittees to generate ideas of how to do it, and this was one of their ideas. They followed through on it without checking with Jay, but that's why they're doing it. They're looking for tools to conserve land.
I wouldn't object to tabling this and letting us think about it some more.
Me too, because I don't think I've given it enough thought, and I think it sounds like maybe folks are thinking about just an exemption for properties in perpetuity. So I don't know. Did you have some sort of amendment or something you wanted to do, Dan, or?
I don't, because, so, if we did something, if we changed this to just be in perpetuity, what we're not doing is aligning with Danby's law at that point, and we're also like inventing this idea for other towns, which, you know, I might support, but it's not coming from the towns. It would also be us inventing this idea, and I'm not sure that we want to be doing that. I'm just not sure.
Have an opinion, Leslie, that you want to share?
I think I want to think about it a little bit more. There could be reasons for short-term easements, and so I'm not sure that we have all the information that we want to be considering why it would be important to set something aside for a period of time, whether it's for a study, whether it's to look at an entire, say, watershed and understand which things are most critical for long-term or perpetual easements or something like that. There could be a reason, but I haven't gotten into it enough. Probably would be helpful for us to talk to the Kimberley Land Trust that does this all the time and understand what their perspective is, just from their experience, but also to look at some of these other towns and counties and how they've been utilizing this or where they found loopholes or problems. I think that would be useful.
Okay, Jay, do you know, is the town of Danby, like how soon is it, they're talking to Assemblywoman McKellis, but like, is this something that they're going to be doing soon, or what's the timeline?
The last time I checked, it was passed by both houses and just waiting to be delivered to the governor. And as we know, there's no rhyme or reason. There was a similar conservation easement for a different town that was already delivered and signed by the governor.
Okay.
When it would be done. I don't think there's any pressing need because we're not, the towns can do what they want to do. The schools can do what we want to do. If we were to pass this, it would only be on county tax purposes only and not school, town, or village.
Right. So, Rich, was that a motion to table this, or
Sure.
would we rather withdraw it? Kathy's saying, who moved it?
Rich moved it, Dean seconded.
Would you like to withdraw it for now?
You bet.
Yes,
Okay, and so committee, what do you want to see happen next? Do you want Jay to come back with us with more information? Do you want to do your own research? How do you want to keep moving forward with this?
I would appreciate Jay coming back to us with more information.
Okay. I'll talk to Andy Zepp and see if he wants to come next committee meeting as well.
Okay, that would be great. Dan?
so also I did alert the town of Danby town board that there were some questions, you know, this was coming before us, and that Jay, you would give us some information last meeting, and I relayed that to them. And so I will report back to them too, and I will about our specific questions or my specific questions, and to notify them that next meeting, if that works for you, Amanda, that we're gonna take it up, and they would be invited as well. If that's okay.
Yeah, that's great. Let's plan on next meeting. If that doesn't work for your schedule, Jay, or for other folks, then we can put it off again, but that would be really great. Okay, anything else on this? All right. All right, we've got one more resolution from assessment, appropriation from contingent fund increase in 2021 budget, assessment department, ID 10289. Rich moves, Leslie seconds, and Jay.
And so this is a continuation of the discussion we had last time about whether we should continue with the annual reassessment program or hold off and go to a fractional level of assessment for, say, 3 years in order to build capacity for the 5 vacancies that I had at the end of 2020. It's hard to replace that, but we have a plan in place in order to address bringing everybody up to 100%, and then also be able to maintain still collecting building permits and sales. And it's a little change in how we do things here, but we can get it done. This budget adjustment would allow us to increase our target for 2021, hire 3 positions as of October 1st, give or take whenever the first day of the pay period is, and be able to get them trained enough in order to handle the informal assessment review meetings that we'll have in February and March of next year. So this adjustment, along with the adjustment to the 2022 target, would allow us to stay at 100% and continue the work that my office is known for.
Okay, great. Questions? Comments? We did talk about this last time, Rich.
Yeah, Jay, I appreciate your work on this. I just say keep us advised as you're going along. See if we need to reevaluate if you can't find appropriate people.
Yes, we did. We have the positions posted. They're through October 13th. And you never quite know what you get, but looking at the resumes, we do have enough choices based upon resumes. But people and resumes are always different from what I've learned. So it's always good to look at people whose resumes don't match up as well.
Okay, Lisa.
One edit or question on the final result of the resolution, where we're adjusting the fiscal target for 2022, including the salary and fringe rates for the 3 positions. Is that correct? Not 2?
Yes, three positions, 2 titles. So it would be 2 assistant real property appraisers and 1 data collector.
Okay, so we need to change that to 3 positions.
I'll move that.
Okay, or is it friendly?
Brenda?
Okay, so that last sentence, instead of 2 positions, 3 positions. Thank you for catching that. Okay, anything else? All right, all in favor? That's unanimous. Great, thank you so much, Jay. Let's see, Mike Lane, you had a question for Jay.
Yes, please. Jay, I wanted to renew a request I made 2 or 3 years ago. And that is, I really think our property tax bill ought to have information on it as to whether or not the property is located in an agricultural district. That information is required with every real estate transaction on the RP 5217 form. And also it's required when the property owner is making out his or her property condition disclosure report. I'm seeing a lot of things come through with misinformation from realtors on whether or not the property's in an ag district. A simple yes or no on the bill would solve a whole lot of problems.
I wholeheartedly agree with you, and I'll try to get an updated coverage of our ag district maps. However, the last time I had it, it wasn't accurate enough for my needs. It wasn't delineated by tax parcels, so there may be a 2-foot little sliver that would go over onto a parcel that wasn't in the ag district. So there was no way for me to mass import all of the ag district parcels. So as it was maintained by other departments, I didn't have control over that data and wasn't comfortable using it. But I'll work with Greg and his people in GIS and see if they can clean up that coverage, and then I could utilize it into our records. But without a clean coverage, I can't update it. But we'll get it done, Mike.
That sounds like a great way to go forward on this. Didn't realize about that problem, but hopefully the 2 departments can resolve that.
Great, that's great. Thank you, Jay, and thanks, Mike, for bringing it up. Any other questions for Jay while he's here? All right. Thank you so much for your time, Jay.
Thanks. Take care.
Okay. Moving on, we have a resolution from administration. Resolution authorizing use of American Rescue Plan funds in compliance and supporting requirements. Doc ID 10294.
Revised copy.
Bias copy. That looks like it has a couple little changes. Can I have somebody move the revised copy? Leslie. Seconded by Dan. Rich, go ahead.
I would offer some amendments. These are from Deborah Dawson. To put them on the floor here, a new whereas that reads, the legislature is about to establish a community resiliency grant program using unassigned general funds, which will require support from the Department of County Administration staff. And then in the new third whereas, the last one, after and compliance requirements, add the language, and to provide administrative support for any resiliency grant program that the legislature may establish. Now therefore be it.
Thank you, Deborah, for sending that along. Sorry I didn't talk to you earlier about this. Rich, why don't you say it again so everybody gets it, and make sure Kathy and Brittany have that.
Okay. So the amendment would add a whereas. The legislature is about to establish a community resiliency grant program using unassigned general funds, comma, which will require support from Department of County Administration staff, comma, and then in the next whereas, in the last line after and compliance requirements, add the language, and to provide administrative support for any resiliency grant program that the legislature may establish.
Okay, question?
I think we need a
Oh,
second.
we need a second. Leslie, you second that? Okay, question on the amendment. Leslie?
I guess I would ask Lisa how that fits in with the work that's expected of this position. If we don't have a clear definition of what level of effort the new community resiliency fund might require.
I think that's a good question. This is the first I'm been notified of it, and I don't know what level of support we're talking about. This person will be has a background in finance, et cetera. So for that level of administrative support is required, then this person would fit the bill. In terms of administering grants or administering a grant program, I don't see this position as doing that, but
Okay, Deborah?
Yeah, Lisa, I thought that you and I had discussed this to some extent. My concern is simply that given the action that the legislature recently took, dedicating all of the funds, the ARPA funds, to operational use under the lost revenue section of the ARPA, and given that ARPA is temporary, I was somewhat concerned that we're adding a target position to just comply with the reporting, monitoring, and compliance requirements of Treasury for this one single program. And it was my understanding that this person would also be providing the administrative support for making sure that the grants that we give out to whatever community organizations and institutions qualify for this upcoming program would have to be supplied by someone in admin, and the logical person was this additional person. I don't really think it's so much a grant evaluation job, as you might have seen in the resolution that was included in the expanded budget committee agenda. We're considering a couple of different options for how grant proposals would be evaluated and processed, and that work would be done by groups of legislators. We just need somebody to mind the money as it goes out. If that's going to be a problem for this person, then I guess I'm wondering what this person's going to be doing besides the compliance work for ARPA.
So we haven't had this discussion yet, but the position is temporary for the length of time that we have ARPA. It's not intended to be a permanent position, and that's been the candidates have been made aware of that. And this person certainly could administer grants, or could do the financial administration if that's what's being asked of and required. And I read the resolution to mean more of an administering and oversight of a grant program, which is a larger endeavor.
Rich?
Yeah, we're going to have further discussion, I believe, next week at Budget, Capital, and Personnel. And Deborah and I have had some conversation about this already, but I believe it's important that we do connect our receipt of the ARPA funds to the county with our commitment to try to do something on a larger scale to, at the same time, use fund balance for community projects. And they'll definitely need some administrative support and oversight. So I guess how that looks could change, or, it's really up to county administration how you want to do it, but it has to get done in some manner. I don't know that this language prevents you from doing it as you see fit. It seems to give another reason why this data analyst position should be established, because there will be a financial component to it. So I guess I support the resolution as amended.
Deborah?
Yeah, another piece of this that I would commend to your attention is the fact that however we set up this resiliency program, and whoever receives the funds for whatever purpose, I think that will have an impact on the budget decisions that we make. Because if we're supporting an initiative through this community resiliency grant program, then it would seem to me that would mean that that organization might need less support from our annual operating budget, at least for a couple of years. And wouldn't that be something that administration through the budget analysts would need to bear in mind when putting together our budget?
Leslie?
I'm a little concerned that we're expecting a person coming in to be doing the auditing, financial support, the back end of the books, potentially administering a grant program yet to be defined, all at the budget, at the salary that I'm looking at right now in one 40-hour-week job that's temporary position. I don't know that we have enough definition yet of how we're going to move the resiliency fund forward and what that will entail on the administrative side. I know that generically we've talked about something that there might be some administrative costs affiliated that would need to be considered from ARPA funding. I don't know if we know that this particular position can do all that. That's my concern.
Yeah, I think that's the question. Lisa, do you feel like this amendment is going to be too restrictive or?
No, I think that given the scope, just so that everyone is aware of the scope of work and the job duties of this person, that it is, you know, a budget analyst, it's financial and audit and compliance related and not a grants management role. That's basically all I was.
Sure. Does this leave room, I mean, like Leslie said, we're still kind of figuring this out. We're having a meeting next week to talk in more depth. I mean, I feel like things are evolving. So does this leave room for things to continue to evolve? Sure. Okay. Do people feel okay with this?
So Lisa, I just want to make sure that you're saying the wording of the amendment is okay with you, or I just want to.
Yeah, I do think it would make sense, and for a community resiliency grant fund, admin would need to be involved and understand the funding pieces of it. I don't have any concerns about this person being involved on that transactional level in terms of helping to provide insight and formulate a grant program. I wouldn't see this role as doing that. If that's not what's being asked, then that's fine.
Folks clear? Fair enough for now. Okay, so we need to vote on the amendment. Everyone clear on the amendment? All in favor of the amendment? That's unanimous. Back to the main motion, which is the full resolution. Any other questions or comments on the resolution? Which I guess is also going to budget, capital, and personnel. Leslie?
Just so we keep in mind whatever our goals are and what level of administration that'll be needed in order to be timely, to spend the money and to be effective in the community.
Yeah, and again, it is evolving, and I think flexibility from everyone is good. All in favor? That is unanimous. Thank you. Okay, great. Thanks, everybody, for that. We have several things under the legislature. I'd like to shift things around a little bit because I know Greg is waiting. Dr. Claypack is here waiting. So let's talk about the redistricting for a minute, and then we can talk about the recommendation that county employees be vaccinated. So, yeah, you said.
Also, another resolution.
Yes.
I don't know.
Oh. The budget adjustment one? Okay, let's we'll do that at the end. But let's just, I just wanted to give an update about redistricting, and I did include just a very basic timeline that I met with Dominic and Kathy and Mike Sigler, and I'm sorry I can't remember who else was there, but we did kind of go over a basic timeline. What this legislature needs to do and our GO committee needs to do, our main goal is to appoint commissioners. And we agreed at our last meeting that the GO committee would serve also as the interview panel. So we kind of worked backwards from when we'd like to get this commission appointed. Kathy suggested the December 7th legislature meeting, and then working backwards from there. GO would have to pass a resolution before that. We have a GO meeting on December 2nd. So we'd like to get this in place by December 2nd. So starting from now, Dominic, our communications director, is working on public outreach, some press releases, we need to make the community aware that we're looking for people to serve on this independent commission. So we are relying on Dominic to help us with that. We're gonna also be asking legislators and to share this information. We want to really get it out there. We intend to have the application period open from August 15th to September 15th. And what people will need to do, anybody who's interested, is contact the legislature clerk's office. They'll fill out and our traditional advisory board application, which gives all their information. And anybody who fills out an application will be considered to join the commission. We're looking for 9 people. Hopefully we'll get more applicants than that, but we finally need 9 people. So during this time, I think our GO committee, we need to finalize our process and our interview questions. We do have interview questions that Kathy shared with me from 10 years ago. So I'm going to look at those again, probably share them with you on email, and we can finalize, our process before we start interviewing people, obviously. Application period would close on September 15th. And we'll have a couple of weeks in there for our clerks to help us schedule interviews with the interview committee as well as the applicants. That will also be a time for the interview committee to review all the applications, have time to read through everything and know who we're talking to. We'll set up the interviews in the month of October. I know it's a very busy time. There's lots of other things going on in October, but do need to get this done. So I guess we'll also see how things with COVID are, and if we want to have Zoom meetings or in-person meetings. I guess we'll have to talk about the technical aspects of interviews. And then we'll have a period where if we need it, the interview committee we can meet again to discuss, make our final decisions about the 9 people we want to be on the commission. And then we will, as the GO committee, give that recommendation to the legislature. And the legislature will pass a resolution to appoint the 9 people. So that's a very brief rundown of what we're going to do. Obviously, it's open to discussion if people have other suggestions, or if you think we need a different timeline, please, now's the time to give feedback. Leslie.
Can you just remind me of the timeline that the commissioners will have to work on redistricting?
Well, I would maybe look to Greg. In theory, they have as much time as they need and want. They will work with Greg, they will work with other experts, other administration staff, other county folks. They can reach out to people outside of the county, they can have presentations. They'll probably do public hearings for the public to come and give input. So they could take all year if they wanted to. They could take 3 months. It really is going to depend on people's schedules. But I'll see what Greg thinks about that.
Ultimately, the deadline for something like this is based on the election cycles. So the information for redistricting has to be approved with enough advance notice for anyone running for election to understand their boundaries of their future district. In addition, the timing issue also is a question with the city of Ithaca as well, since their ward boundaries should ideally be contiguous with the county legislative boundaries in the city to avoid any further complications between the citizens, between where they vote for city boards and
So, yeah, so, and I did have a conversation with Laura Lewis on Common Council. She said that they need to have their process done by, they have a next election, not in 2022, but 2023. So they would need their process to be done by the end of 2022. We can take longer than that if we need to, but we do need to like communicate with them, and the commission will need to communicate with them. And I mean, I would kind of hope it wouldn't take longer than that, but yeah.
I just assumed as we're recruiting, we need to tell people what their time commitment is, when we're expecting it to be done, how much time staff need to make that, you know, something real or an adoption by the legislature. So I assume we have a timeline to give to folks about their commitment.
I mean, we kind of talked about that with Kathy and Dominic. Again, it kind of depends on people's schedules. If people can only meet once a month, then it might take longer. If they can meet every 2 weeks, then they might get done faster. So, you know, and it will depend on the staff as well and how much time they have. So it's a little bit nebulous. Other questions or thoughts or anything that I missed, Dominic or Kathy?
Not that I can think of. That was a great update. That's all I would have.
Okay, and Dom, you will share whatever information you have, and legislators will help put that out to our networks.
Yeah, I have the draft press release I'm working through, as well as the some graphics that we can use as well to share, and then we'll prep for that information session. I think we have that on the 19th. So I'll make sure there's a script of questions for that and everything prepared for folks will be on there.
Okay, great. Leslie?
So I was going to work backward from whatever our timeline deadline was to understand the pressure of doing this immediately. I know we've gone back and forth around what's the pressure as far as getting the commissioners in place and getting launched. Usually it's around like when the deliverables do. So this will be a busy fall to try to pack that in, especially in October for interviews. Just wondering.
Yeah, I mean, again, for us, yeah, we technically have until February 2025 to do it, but I think, you know,
I guess I'm just worried about the this recruitment period happening at the end of summer, when I know people are trying to get a last minute vacation and such. If we can get, maybe we'll get great interest, but we may need a little more time to recruit.
Yeah, I mean, I think if it turns out we don't get enough applicants or we don't have the right applicants, we can extend it. And I mean, we've seen that in other searches for sure. Like sometimes it doesn't work out the first time. So again, we are lucky that we have a longer time period if we need it. All right. Great, thank you for that, and thanks for folks who are working on this. All right, let's go to the resolution that you got on your desk. Implementing New York State Governor's recommendation that all county employees be vaccinated against COVID-19 or get tested weekly. And that's ID 10296. And Rich moves that, seconded by Leslie. And don't know if folks have had time to look through all this information that we've been given. Leslie?
Just a couple questions at the bottom of page 1 where we have blanks. Are we proposing what the schedule is, or are we expecting a proposal?
Is Amy there?
I am. Can you hear me?
Yes. Why don't you give us a few thoughts about this?
Sure. So what we provided for you as requested was a resolution as well as some guidance. We met as an internal team, and then you also have a letter from Dr. Klaypeck that was also requested. What we wanted to provide you is a status update, what it would look like. And I'm trying to pull up mine right now, and for some reason it doesn't want to open for me. But there's considerations which made us leave some blanks because there are some things that would need to be funded. So I can talk you through kind of what the team was considering, and then we can talk about the resolution if that makes sense and what you would like to do. So
yeah, that'd be great.
Okay. And Lisa, feel free to chime in. I can't see you. I'm hiding up in Frank's office today, so I'm not there as I normally would be, but we started by looking at the current status of our employees. Over 70% of our employees have attested that they are already vaccinated. The remaining 30%, about half of them have not attested their vaccination status at all. So they may be vaccinated or may not be, but they've chosen not to volunteer that information. And then the remaining 15% are not vaccinated. So they have attested that they are not. What we wanted to make sure is, as you know, New York State is mandating the vaccine or testing. And so we wanted to bring that for your consideration as asked by some of the members of the legislature. In that consideration, what we know is the vaccines are safe and effective at preventing the disease, and especially at preventing severe illness and death. And having the vaccines helps reduce the spread of the virus. The other piece is we've talked about herd immunity or population immunity, and having more people vaccinated helps us get to those levels of vaccination. And of course, Dr. Klaypeck can talk way more about that side of things, and I believe that's in his letter. As we started to look at this process and having mandatory vaccination or testing in place, we would recommend to begin that on October 1st. That gives time for those who are unvaccinated to go ahead and get vaccinated. Obviously, this resolution would have to go through the full legislature, as well as I believe it's going to go to budget, capital, and personnel. So it gives time for employees to go ahead and get the full vaccination if they choose to do so. So that date is in the resolution. We could also edit or modify that, but that's our recommendation. As far as how people would get vaccinated, the health department has been putting in pop-up clinics, as you guys all know. We would assist the county in scheduling an employee-only vaccination clinic, as well as providing them the information of where they can get vaccinated. Local pharmacies, some of their local healthcare providers still have vaccine on hand, and so we would make sure that people are aware of where they can get vaccinated. What we would also do is continue to use that same secure portal. So once people are vaccinated, they would put that information into the portal, and we would be able to collect that information. From there, we would also know who has decided not to share that information or are not vaccinated. And that's where we get into surveillance testing. What you will see is there's still a lot of ins and outs of developing a surveillance testing program, and we haven't gone through all of that in the last week, but we are starting to kind of understand what that could look like. We have done some surveillance testing in certain facilities within the county, so we know some of that. We've also partnered with all of our community partners and been able to observe their programs. So that's where we get into some considerations on how often you would like to do the testing. We have in your documents, we could do it once or twice a week. There could be costs associated with that. So currently testing is free in the community because of the efforts of the legislature to put forward funding to pay for that testing, which is a FEMA reimbursable expense. However, the federal state of emergency declaration expires on September 30th. Now, I don't know if that will be extended or not. It has been extended several times, but if it were not to be extended, we would have to then pay for testing expenses for our employees out of pocket. Those expenses, if we were to use the current employees who have not attested their vaccination status, is about $15,500 each time that we do testing. So if we were to do twice a week, we're looking at $31,000 every week to test those employees if we were to do it twice a week. again, I will, after I'm kind of done with this, allow you to ask questions of Dr. Claypack or others that have worked on this on, you know, a recommendation for how often. I will tell you it's quite an analysis on how you make this determination. So I'll let Dr. K talk more about that in just a moment. The other side of running a surveillance program is how we get the information and share it with our employees. We need to really kind of go through all of this. What it looks like currently in the places we do it is we have a collection spot where the samples are collected and then they are transported to Cuga Health Systems, who runs those tests. It's all done with barcodes, so no one knows kind of whose sample is whose. However, we would have to know when people have actually submitted their sample. There's other considerations about the types of tests. Cuga Health Systems uses the PCR tests, not the antigen tests. We would want to make recommendations on how our employees are tested and where they're tested. Also considering that we probably don't want them to be leaving work for extended periods of times to take those tests. So we want to make it convenient. We also want to make sure that it is the same throughout. So we would work on that as well. We have reached out to those other partners who have mandated testing programs to see how those testing programs are going. And so we can also learn from their best practices, look at their materials and move it there. What we'd like to do, and it's in this resolution, is county administration would be charged with really setting up that program, working not only with human resources in the health department, but also our unions and others to ensure that we really are thinking about how to best do this and meet the needs that we are trying to, which the goal of all of this is preventing disease and spread within our workforce and communities. So how do we do that? Questions have come up about employee discipline. If someone were to choose to not comply with the program, how would this happen? We would follow a progressive discipline process because this would be a mandated program. So it would be mandated that someone either is vaccinated or receives testing on whatever weekly basis or however you guys want to determine it. So those are the big things. The other piece is the legality of this. As we shared, the Justice Department did release an opinion about the emergency authorization piece. We also know that some of the vaccines are close to be receiving the full FDA approval. But at the same time, just because it's still under emergency authorization, there are a lot of reasons why we still can move this forward. And again, I'm not going to talk to that. I know Jonathan is on. We've also met with Labor Council to discuss all of the ins and outs of this. We have notified our union representatives that we are looking at this. They've received all the same information that you've received, and we'll continue to work with them with whatever direction the legislature chooses to go. Lisa, I'm going to turn it over to you if there's anything I missed before, or however you would like to do that, Amanda.
Yeah, no, Lisa, if you have thoughts. I think you covered everything beautifully, Amy. This is you know, what we've come up with in the last week or so based on your request for information. So thank you to Amy and to everyone who's worked on putting this together.
Yeah, this is great. I'm going to ask Dr. Claypack, thank you for being here. If you have any thoughts you'd like to give us right now, or do you want some questions, or? I think you're on mute still.
I think a good starting point is to start with questions that you all may have. That may be the most relevant way to go forward.
All right, Rich.
First, I make a comment that this is really infuriating that we were sitting here with masks on when there is a vaccine available and it does seem to be safe and effective. And that we're wearing the mask largely because of a surge that's occurring in the unvaccinated population. I recognize that there are some people that cannot take the vaccine and others who have religious reasons for not taking vaccines. But there's a large category, it appears, that just don't feel like doing it. And here we sit wearing masks and worrying about this latest variant. I support the resolution. I'm thinking we may want to change the language in the first resolve to say undergo testing on a periodic basis as recommended and overseen by the county health department. Because this is an evolving situation and the frequency of the testing and the type of testing may change, and we shouldn't have to come back and bring in a new resolution in front of the whole legislature to do that. I think the intent is get vaccinated. If you're not vaccinated, there has to be a reasonable testing protocol, and I would do that.
That's great. Did we move this? Okay. Is that friendly? Did you move it?
I think I moved it, so I'm not sure I can be friendly to my own.
I think you can be friendly to yourself.
Okay, my own best friend did it. I would ask us to change that.
Yeah, I think that makes sense. Whoever the seconder was, is that friendly? Is that you? Yeah. Yeah, I was gonna ask about just the blanks as well, like, yeah. But the language that you just said, Rich, does sort of speak to the spirit of it.
And maybe what we need to do is to have the director of finance report to us on what is needed to transfer from contingent funding. Once it's determined what the testing protocol and frequency is going to be.
Right.
I have a question. It seemed like the percentages given at the beginning of the presentation by Amy, thank you, Amy, for that, 70%, greater than 70% vaccinated, 15% unvaccinated, 15% haven't responded. Is that, would that be accurate to say that?
They either didn't respond or they responded. So there was a category where you could say you don't want to volunteer.
Got it.
Yep.
Is there going to be something in here that requires response with a mandate that we, in order that we know? I mean, this is not insignificant cost as you described it, and understanding what a weekly, you know, should that be what the Department of Health defines, which seems to be pretty typical for folks that are working every day, is a weekly test. That's a lot of money. And so I think that mandating that folks respond with the mandate for vaccination seems very reasonable and required, so that we understand what's going on.
So you're suggesting that folks who have not responded yet are required to.
Right, it's part of the process that Amy was describing, whereby folks need to respond, and then we move through a series of I don't know, administrative penalties, I guess. It seems like we're going to need to understand for the cost, for Rick to give us a good number, we need to know what we're looking at for testing. And I don't know if there are other options that have been explored with regard to people being at work or not at work. I know that's outside of the scope of this particular resolution. The other question would be, is October too late? Can we move those dates up?
Okay, good questions. We've got a couple more hands, so let's keep going through this and then we can come back to that question of the requirement. I think Mike Lane and then Deborah.
Sorry, I'm not sure who this question goes to, but is there some way we could require the employees that needed to be tested to pay a share of the cost of those tests? I think that would do a couple of things. It might be an incentive for folks to reconsider whether they want to not have the vaccination, and it would still allow people that have legitimate reasons not to have them to proceed. And it doesn't have, it could, even if it was 20%, for example, like we do on the share of the health insurance premiums. I think that ought to be looked at if it's possible.
Lisa has her hand up to respond, and then maybe Jonathan has a thought.
I think he's gearing up as well. We had this discussion yesterday, and so mandating a test and then mandating that an employee pay for the test. That's a term and condition of employment, and it's I believe, a mandatory subject of bargaining that, we would be changing the terms and conditions of employment, and it could put us, at risk for litigation there. Jonathan?
Yeah, no, that was pretty much what I was gonna say. I mean, if you're affecting an employee's salary, for example, or requiring them to pay something, the union would almost surely claim that's a mandatory subject of bargaining. They would likely, or there's a certain possibility that they would win on that. So I think we don't want to get into things which could arguably be mandatory subjects of bargaining.
Yes.
Mike, did you have another part?
If I could just follow up just for a second, but if the purpose of this is to try to get more of the employees vaccinated, which seems to be what we're trying to encourage, I would think if we talk to our unions about it, that their membership, a lot of them would like to work with vaccinated people and not unvaccinated people.
Well, I mean, I agree with that, but that's a different subject than them causing union employees or members of the union to have to be out of pocket money. I think they'd view that.
Well, I know, but it might be how it's discussed with them. I'll just stop at that. Thank you.
Okay, we've got Deborah, Ann, and then Henry.
Yeah, thanks, Amanda. I understand that this would be a condition of employment, but I mean, is it out of the question to negotiate an MOU about an additional condition of employment in the middle of a contractual term? As I see this is a public health emergency. These are people who are paid on the public dime. They are working with the public. Now, if you have a health reason why you can't be vaccinated, I think it's fine if the county pays to get you tested once or twice a week. I don't have a problem with that. I do have a problem when you simply refuse to take an action that's for the benefit of the public that pays you, the public that works, that you work for, the public that you work with. And a bigger piece of this that really drives my anger at people who simply refuse to get vaccinated is that the longer we have a significant percentage of our population walking around unvaccinated, opening themselves up to getting sick, the more likely it is that eventually this virus will mutate into something that can work around the vaccines that those of us who've been responsible have received. I think if there's a way to negotiate this with the union, people who simply butt-headedly refuse to get vaccinated should pay the cost of keeping their job despite the fact that they're refusing to take an action for the public good.
Okay, thank you. Ann.
Thanks, Amanda. First off, this resolution, I'm not seeing it in the agenda packet. Is that correct?
That is correct. This was given to us today.
Can it be shared on the screen for transparency and for, it's a little hard to, was it sent to all legislators? Either way, I think if we're doing something that's.
It was handed to us as a paper document, so I don't know that it's been on email. I haven't checked my email.
Okay, looks like Jay, I'm seeing a note Jay just sent to me. Okay, just thinking of in the future, sometimes, in different committees, I've done it before too, something last minute so that.
Yeah, definitely. But we just got it as well, so.
Okay, so I'll take a quick look at it and comment if, but I'm supportive overall of this. I just wanted to add to what some people said off the bat that there's a lot of misinformation out there. So yes, so I want to make sure that at least I don't peg people as just not wanting to. There is a lot of unscientific misinformation out there that people are relying on, unfortunately. So I'll comment again if I have anything else. Thank you.
Okay, thank you. Henry?
Yes, thank you for the information. Amy, I was since I don't have the report in front of me, I was curious to a couple of things. One, we're talking only surveillance testing of the people who are in theory unvaccinated or have not given you the information.
Correct.
So we're not talking about the Cornell surveillance testing of the entire campus, of everybody.
Not at this point. Until that FEMA changes, we're not mandating surveillance testing. I should say that, but surveillance testing is available through the county's partnership with CHS for all our employees right now.
Okay. Also, you talked about the partners who have mandatory testing. Which partners are those?
Cornell, Ithaca College had a mandatory testing program, some other community partners as well. It's looking back at how they did that. Really, the previous academic year is the higher ed partners is where we were talking.
You mean the mandatory testing of students?
Students and staff. Some had some mandatory testing for staff and faculty that were on campus.
Okay. Thanks. That's all I want to know.
Okay. Other questions, Dan?
Yeah, just wanted to say, I mean, I was all in favor of this until I heard that estimated price tag, which is $1.5 million a year potentially. That, I don't know how to think of it all of a sudden.
Yeah, Leslie.
I would think of it as a requirement for doing business if we're going to have unvaccinated folks working. And so we better figure out how to budget for it.
Yes, I mean, this is the policy decision that, is being put before us. There's a value in people choosing to get vaccinated of their own accord, and those who aren't, the rest of us have to decide how we're going to deal with that. I think the question of requiring, what Leslie said, requiring people to say yes or no, I'm vaccinated or not, no more of this, I'm not going to tell you. I think that could be very helpful in determining how many tests we need on a given week. So that might be something to think about. I don't know if we want to add this in, and I believe, what's the next step for this? It's going to go to budget next week, or?
Yes, it's supposed to go to budget. It'll be added to their agenda on Monday, and then the special legislature meeting at 4 o'clock on Tuesday.
Okay. Rich, did you have your hand up again?
Yeah, no, I share Dan's concern, but I think Leslie has the right answer. It's the cost of doing business. It's yet another reason why this is infuriating. And certainly if we can encourage more people to get vaccinated, we drive that cost down.
All right. Let's see, I see more hands. Anne, then Henry, then Deborah.
Thanks, Amanda. So thank you to Jay for sending me the resolution. So I would be in favor of testing one time a week. I'm not a medical professional. Well, actually, I used to be, but not in this field. But so I would be in favor of one time a week, and then maybe pending, change per recommendation of our administration or health departments. And that's just one suggestion. And then one other suggestion is that if the nasal swab testing is available to be done, that is an incentive to people. So that's all I had. Thank you.
Well, I did the saliva test this morning, and let me tell you, you need to get a lot of saliva in there. hard, trust me.
But I think we've addressed that issue of once a week already.
Right, right, with the amendment of on a periodic basis as advised by the health department, right? Is that what you mean? Yeah,
Yes.
we added in a little amendment. Okay, who's next? Henry.
Yes, for Dr. Claypack, you've talked about herd immunity. And when you talk about the 70% of our employees already vaccinated, if we get to 85%, do we have to continue to test and do everything?
So I hearken back, Henry, to earlier in the year when the numbers about what level of vaccination would be required nationwide were being batted around. And you recognize that experts in the field started to say, we really can't fixate on a number. Really what's important is what happens with this pandemic. And so in June, going into July, when we saw the drop in numbers in our region, and we saw our caseload go from in the hundreds down to 4, we all felt a sense of optimism. However, in the health department side, we also felt a sense of expectant observation. And then we, of course, saw a resurgence. The exact number that's needed is dependent on a number of factors, and one of them is what exactly is the variant you're dealing with. The Delta variant, compared to the United Kingdom variant, is much more contagious. That raises that increases the need for more generalized vaccination. What that exact number is, I don't think anyone could exactly tell you. But what is true in cooking as well as in healthcare in a pandemic, I think, is that the number of cases that you're dealing with and how long they stay down and for how and seeing them drop from the levels we're currently having to deal with to being at very, very low numbers, 0, 1 or so, and then staying there tells you, hey, we've achieved something. Our numbers went down, they didn't stay there. And that I think vaccination level in the county is one of the factors. Vaccination level in the state, of course, is important, and nationally as well. It's hard to give you a number. It's going to be what it takes. And I think that at every opportunity, we need to try to get as many folks vaccinated as we can. I'm struck by the 70% number. That's a nice number. And I'm also struck by the 30%, some fraction of which are not vaccinated people. So the maximum would be about 1 in 3 employees are not vaccinated, potentially could become infected. We don't know what their behavior is like outside of the workplace. We've started advising using masks in the workplace, which helps to mitigate the pandemic to some extent. We're doing disinfection. We're doing all those things. But maybe 1 in 6 or 7 people is truly not vaccinated. Maybe it's as many as 1 in 3. That strikes me as a lot of people that are rubbing shoulders with other individuals. And unfortunately, we have seen that if you're vaccinated, you still can become infected. And although you don't get seriously ill, the number of people having long haul COVID is not something to be forgotten about. And it can cause you to be impaired, even to the point of not being able to work. So it's a big deal. And we know it affects adults, and we know it affects children. So I can't give you a number, I'm afraid.
Okay. And
Right.
the other,
Do
the
you
other
have more,
thing,
Henry?
excuse me?
You have more?
No, that's okay.
Okay, let's go to Deborah, and then we do need to move on because we do have several other things still. Deborah?
Thanks, Amanda. Yeah, I mean, when we talk about the cost, I just ask that you all consider the fact that a lot of our employees, whether they're vaccinated or not, if they get sick, they're going to take the virus home to their families. And I don't know if you all saw, Paul Krugman had an op-ed piece in the New York Times a few days ago where he cited the fact that there are 50 million or more children in the United States who are too young to safely be vaccinated. And honestly, that number struck me as a grandmother of two. 50 million children. The refusal to get vaccinated is endangering them. And, we all say children are our future, but think about that. I do think that people who refuse to get shots, against all the scientific evidence that says that they should pay their own freight for that refusal. But if we have to pay some of it, it's worth it to protect the children in our county.
If I might add another statistic, the rate of immunocompromised individuals in the adult population is about 3%. And so if we apply that to just the Tompkins County population, that would be about 3,000 individuals within our county borders who, for one reason or another, are immune compromised. And we know the issues there with regard to their ability to protect themselves.
Dan?
So I'm just kind of thinking out loud here. This is all new to us. I do have a sense that that implementing a program like this is actually not going to provide a very high level of safety for our employees, because you're testing once a week. That's an awful lot of time to be exposed to someone who is infected but hasn't yet tested positive for it. So I think it would be a marginal gain. It wouldn't be like even close to a guarantee of safety for our employees. And I'm only bringing this up again because of that price tag. And so I'm wondering if some other options were explored, such as those who are not vaccinated, if at all possible, must work from home, or separate spaces set up. I know there's like a lot of logistical hurdles with that, but there's also a lot of logistical hurdles with weekly testing. So I'm just wondering if some other options have been explored.
Yeah, I mean, I think that's a legitimate question, and we had talked about that with legislators. If there were legislators who were not vaccinated, they could sit in one area and the rest of us could sit somewhere else. I believe we're all vaccinated because we've all been sitting together. But I don't know, Lisa, if you have an answer or thought, or Amy.
I can start. We did explore those options, but that also gets into considerations of terms of employment, those kinds of things, and how that actually plays out. Is it when we have people working from home, that's because they're able to do that based on their workloads and everything else. So that has been considered, but really the mandatory vaccination and testing program coupled together is the way to go, or what we're recommending. It also mirrors what New York State is doing, which is kind of the impetus for us doing this. Lisa, I don't know if you have more to add on that.
I would just say, I mean, we have those unvaccinated employees are among us and working now, and they're being asked to mask. And, some of them work in positions, as Amy said, where they don't lend themselves necessarily to work from home options. So, I mean, we're mitigating the risks. When we rolled out the mandatory attestation of vaccination status, and the carrot, so to speak, was if you had been vaccinated, you didn't have to mask in the workplace. So to date, I mean, that's what we've been doing.
Okay, let's go ahead. and vote on this with the friendly amendment that Rich put in there, Leslie?
And I would just suggest that we amend the second resolve to include a mandated response to the attestation.
Okay, where the second resolve is that the county administrator is hereby authorized to establish testing procedures. And then after that,
Well, I think before that, to require a response to understand who then needs to be tested.
I'd be happy to propose language there.
what's that?
I'd be happy to propose an additional resolve after the first one that says resolve further that the county administrator is hereby authorized to require disclosure of vaccination information from all employees.
County administrator, say it again, so people hear it.
Sure. Resolve further that the county administrator is hereby authorized to require vaccination information from all employees.
Is that friendly?
I'm just curious if Jonathan has an opinion on that, because when we rolled out the first stage of this, there was a decline to answer, and there has been, the unions have discussed about being mandated to reply yes or no. In this case, if they decline to answer, we would then be paying for testing them, even if they were vaccinated. But Jonathan, do you have an opinion here?
Yeah, to be honest, I'm not sure it makes any sense, because those who either decline to answer or, haven't submitted a form or said no on the form that they haven't been vaccinated would be required to be vaccinated, and we would be required to get the results. So, it would sort of, that already covers it, right? Because we'd be getting the results we'd be requiring those people to be vaccinated. I mean, to be tested and the results of those tests. So having them fill out the form, requiring them to fill out the form would just be duplicative, because we already get.
Okay, so if they say, I'm not gonna fill out the form, they would still have to be one of the people who was tested.
Exactly, and we'd have to test results. So having them, requiring them to fill out the form would not be just be problematic, but it would also be duplicative. It wouldn't give us any information we don't already have.
Happy to withdraw.
Leslie, another thought?
To Dan's point, it's money. It's not insignificant. And if folks are being coy, instead of answering a question whereby they perhaps are thinking of it in a different way rather than around from a public health lens, it would be helpful to know if they actually are vaccinated and thereby save us some money.
Right, because if they are vaccinated, but they say, I'm not gonna tell you I'm vaccinated, they still have to get the test.
I guess in that instance, they have to get the test, which is not entirely pleasant. That's the cost for them. I wish they would tell us if they're vaccinated, but to Jonathan's point, we may be creating more trouble for ourselves by asking them to be reasonable that way.
Thank you for the discussion. Anything else before we vote on this, which will then go to budget committee and then go to the legislature?
Could I say one more thing?
Sure.
You shouldn't be totally unconscious to the potential costs and issues for employees that do not choose to do either of these things.
Right, so somebody could say, I'm not gonna get vaccinated and I don't wanna do a test.
Exactly. And the method and costs of discipline, et cetera, are all very problematic.
Right. So with that in mind and the cost and benefits, let's go ahead and vote. All in favor of this resolution, please raise your hand. That is unanimous. Okay, good discussion. Thank you, Dan.
I need to step out of the room for just a few minutes for another meeting. It's supposed to take 5 minutes, so I hope it's true.
Okay.
I'll go announce it.
All right. Thank you. Thanks publicly. Have a couple of more resolutions here. Legislature, including Resolution Doc ID 10237, authorizing a public hearing on proposed local law number blank of 2021, a local law amending chapter 32 of the Tompkins County Code of Ethics. Leslie moves that, Rich is going to second that, and the next resolution after this is the changes in the code. So this first one is just to set the public hearing, but do folks want to talk about this now? Rich?
This came out of the Ethics Advisory Board, and these are, you can see the changes to the Code of Ethics. They're mainly addressing issues that arose as a result of the state audit and some cleanup in the document. I don't think there's anything groundbreaking.
Okay, questions, other questions? Thank you for working on this. Ethics Board and Chair of Ethics Board, Rich. So let's go ahead and vote. All in favor of setting a public hearing? That's unanimous. Thank you. And then we have resolution 10236, adoption of local law number blank 2021, a local law amending chapter 32 of the Tompkins County Code of Ethics. Rich moves, Leslie seconds. So this is the actual details that Rich was mentioning. They are highlighted in the packet. Any questions or other changes or comments? All right, let's go ahead and vote. All in favor? That's unanimous. Thank you. All right. On the list here. All right, this one was Doc ID 10291, and this was not included in your agenda, but it was given to us today. Leslie, are you moving it? Yes. Rich, are you seconding it? And this is suspension of requirements and bylaws relating to open meetings law for advisory boards, committees, and commissions. And this is a follow-up to our discussion last month with the state of emergency in the state and all our advisory boards meeting and wanting to meet either hybrid or on Zoom, and a lot of lack of clarity on how to go about that. So what Lisa has advised us is that we can suspend, and Jonathan too, I believe, had a discussion about, or Kathy, you're the one who was working on this, right? With Jonathan. With Jonathan, okay, thank you. Is that we can suspend the parts of the bylaws of each of the boards or commissions that say that they have to meet in person. Is that correct? Something like that? Yes. Jonathan, do you have other thoughts?
No, I mean, I tried to kind of explain it in the whereases, but my understanding is that there are quite a few of our advisories committees who put that in their bylaws because that's what they were doing. Now that they have the Zoom option, and they're not really legally required to hold public hearings under the open meetings law. A lot of the advisory committees like that, and we're likely to lose members of several advisory committees if they can't continue that.
All right, Megan, I see you here. Did you want to chime in?
Yes, I just put a question in the chat as well. I think my one question is whether if this suspension is temporary, if during this suspension period, members would be, amenable to us revising bylaws for those advisory boards that are not subject to open meetings, to state open meetings law, due to their powers or, kind of membership, but simply have this kind of quirk of history that many of them have a line in their bylaws mentioning open meetings law. And if we could revise their bylaws so that they would comply with the county open meetings policy rather than going by state law. So in the future, we wouldn't have this issue for advisory boards that otherwise would not.
That's a wonderful idea. And so in our bigger picture talk about advisory boards that Rich and Dan and I are working with Kathy and Michelle and Brittany to think about the bigger picture of all of our advisory boards. Revision of bylaws is one of those things. So if from my perspective, if open meetings law can be written out of the bylaws of committees that it does not apply to, then that's great. I think it's on a case-by-case basis though. Certain boards are subject to open meetings law. So I'm not sure if I'm answering your question, Megan, but I think that if it makes sense to do those revisions. Jonathan?
Yes, so I mean, the resolution says they're suspended until further actions of the legislature. My thought was that during that period of time, those advisory committees would have the opportunity to review their bylaws and come back, because those are approved by the legislature.
Right. Does that help, Megan?
I think so. I'll say the process we conducted in planning and sustainability only for the boards that we support was, we looked at all the foundational documents, the bylaws, and what powers they have, confirmed that, per the Department of State, they're not subject due to their powers to open meetings law. So I suspect other advisory boards that we don't support may have similar situations where they would not otherwise be subject to open meetings law except for their bylaws. So there may be others that we want to kind of group together and take through to make it clear that these meetings are still accessible to the public. We're still posting minutes and all of those things per our county policy. We're just removing the state complexity out of that.
Yeah, absolutely. Makes total sense. And it's great if you want to work on that for the boards that you work with. And we're hoping to get through that with other boards as well. So.
Thank you. And I'll coordinate with Kathy as well. So thank you.
Other questions or concerns? Okay, let's go ahead and vote. I think we moved it, right? Let's go ahead and vote. All in favor? That's unanimous. All right. Now we have the resolution that we added, which is ID 10297. Budget adjustment and appropriation of unspent funds from 2020 and prior years to various accounts of the departments that report to the Government Operations Committee. And if somebody moved that. Leslie moves, Rich seconds. Just noting that it is a couple minutes after 2. We'll try to get through the last couple things here. Thoughts, comments? Lisa, Kathy, does anybody have anything we need to know about this?
For fiscal policy, the legislature reviews and approves rollover requests. And that these are the rollover requests for the departments that report to GO that for use in 2021.
Great. Questions? Okay. All in favor?
Oh, can I add one thing? Are you looking at the revised version?
We only have one version.
Is Is this the rollover request?
Yes, it is, Rick, and the committee is looking at the updated version of, this resolution was not sent out and included with the agenda. So they have the updated version.
They have the one that I finished yesterday?
Yes, they do.
Okay, I just want to check and make sure. Thank you.
Yeah, okay, so I think that was unanimous.
Yes.
All right, great. Okay, that's a lot. Let's see if we have any reports, hopefully not take too much more time. I will forego a committee chair report. We've already talked about a lot of things. Lisa, do you have anything else you want to tell us?
Just a brief update that, you know, the resurgence of activity in the COVID front and the Delta variant, Amy, Dominic, Jay, Katie, and our intrepid staff at the health department have swung back into action over the last couple of weeks. You've seen the advisories that have been issued about indoor mask wearing. There's a COVID town hall, community town hall today at 4:30. And on the budget front, we finished meetings with departments about their 2022 budget requests as of this Tuesday. Dan Nolan came on board last Monday. And he's quickly coming up to speed, and we have a budget analyst hired who will be joining us this coming Monday. So it's a busy and challenging time onboarding these folks to get the budget passed. Get the budget completed to be presented to you to be passed.
Busy month, so we appreciate you doing all the extra work to get through this. Questions for Lisa? Amy, anything from you? Extra?
I have nothing extra. I didn't know if there would be questions, so I thought I'd pop back in, but nothing for you all today.
Any other questions for Amy? All right, thank you. Jonathan, any other reports?
Answer any questions, but I don't have any additional report.
Any questions for Jonathan about anything? All right. Rick, any report from you from finance?
Yes, I have one short thing to share today because it was requested, and I'm going to share the screen right now so that you can see the contingency fund. Let me find it here. Can you see the contingent account here on the screen?
No, we see just like the Windows desktop image.
Okay, let's see. Try something else. How about now?
Yes.
You can see the 2020 contingent account?
Yes.
Okay. This top part of the worksheet here shows everything that's come out of the contingent fund so far. This year we started, as you can see, with $1.9 million. I updated this morning to show every resolution that was passed up until your last meeting. So that was right up to resolution 151. And these are all the costs that have come out of the contingent fund. At the bottom, it shows the total appropriations. Let me get out of this here. Total year-to-date appropriations is 1.4 million. So out of that 1.9, we've spent so far by resolution $1.4 million. Our current balance available for the rest of the year is down to $471,380.
All right.
And that is what one of you asked for, so you asked for it, you got it. Toyota.
Thank you. Questions for Rick? Appreciate you putting that together for us. Thank you.
Sure.
All right, Dominic, are you still there? Any updates for us?
A few quick things. Amy already mentioned COVID, or Lisa did. There's quite a bit of work happening in that arena, as was with reimagining public safety. I did want to update you that we are working through all of the topics that departments would like to share through our email newsletter software that the legislature approved earlier this summer. There have been dozens of ideas that have come from departments, and over the next few months, I'll share what those topics that they're planning to communicate with the public are with all of you. It's really exciting that people are sort of thinking through how they can communicate directly with the public in a new way. So that's been really valuable and expanded our conversation. I'll also say, related to the streaming of meetings and the continuation of this teleconferencing option with the screen in legislature chambers, would really like to get to a place where we know if this is how the legislature would like to proceed moving forward, and on what terms. Is it through the end of 2021 or farther out? We're really looking to plan how to make this sustainable and best shared across staff. We have different resources from our office and admin and myself, from ITS, from the clerks, all sort of intersecting to make it work and try to make it as smooth as possible for legislators. But I think deciding a few things, is it going to continue in this manner? For how long? Can staff and the public continue to join this way? Should we invite the public to do so? There's some outstanding questions that would be very helpful to get to some answers about. So I wanted to raise that. But I know today was obviously a packed meeting, and we're over time. So I don't know when that's most appropriate, but I wanted to raise that flag for you all again.
Yeah, thank you for bringing it up. Does it make sense to put it on our next agenda as a discussion topic? And if you and others have more information and specific requests, that we can talk about those, so we make sure we have some time to talk about it?
Yeah, I certainly think it could go on the next agenda. That makes sense. I think, yeah, we can do that and prepare any information for folks ahead of time. I think going into that, having folks already considered how you all like this current setup will be valuable.
Yeah, and I guess, the other question too is how things are going to change in terms of, COVID and in-person meetings and, all of it. So it really feels in flux, but it does make sense that you have some long-term or longer-term answers about how to go forward. Definitely.
Okay. Well, we'll work on getting it on the agenda for next month, and that's the only thing on my list. So that's all I've got.
Great. Any questions for Dominic? Nope. All right. Thank you so much for all that you do. Committee members, Dan, I meant to send you an email and I forgot about the parking thing. I didn't remember if it was pressing or if we can, okay.
No, it's not pressing.
Okay, then let's talk about it in the next month and see what happens next. This was a topic that Dan wanted to bring up. Okay, there are a couple of budget adjustments and transfer info things, or I'm sorry, I didn't ask other committee members if you had other things you wanted to bring up.
The exciting topic of parking, I don't know. Maybe extend our meeting to take that on.
Nothing beats parking. All right, anything else before this committee? Thank you all very much. Thank you, Lisa. Thank you, Dominic, Rick, Jonathan, Kathy, Brittany, everybody else who is here. We are adjourned.
Thank you.